Welcome back. In today's In Sickness and in Health segment, we're defining obesity and talking about the challenges that come along with it, as well as some of the natural and surgical ways to fight it. For that, we've asked bariatric surgeon Stephen Fowler to join us. Thank you so much for being with us this morning.
Thanks for inviting me.
There's a lot of different definitions, and some people think they are, others don't. What is obesity? Can you tell me about that?
I think probably the best thing is just think of it as a medical term of having too much body fat. Okay. We tend to focus on, the weight or specific metrics or other numbers, and I think probably a better definition would be the bad health conditions that go along with the weight. That's the main focus for the individual.
I was going to ask you some of the challenges that come along with it, and that's definitely probably top on the list, huh?
Absolutely, but I mean, the health conditions that we're commonly associating, like type 2 diabetes, cancers are associated, heart disease, obstructive sleep apnea. These are the ones we commonly associate with the overweight condition.
Okay, so some of the weight loss options, we'd love to talk about that now. What are some of the ones that are out there?
Sure. So everyone's familiar, every 6 months there's some new fad diet. But independent of that, I would say lifestyle modification programs have slightly more success. Our program, we focus on a surgical correction for improving the patient's health. And basically these operations, there's nothing experimental about them. They've all been tried and proven. And typically we'll see maybe 60–80% excess weight loss with these operations. People get off their medications, but it's a surgical improvement for their health.
There are a few different ones, gastric bypass?
Yeah, most people are aware of the Roux-en-Y gastric bypass. That's been around for quite some time. The sleeve gastrectomy is the most commonly performed procedure we do today. And then also the duodenal switch, which is an operation that's specific for the treatment of diabetes.
I guess one of the other big questions is, does insurance actually cover some of these operations?
Yeah, they do. Most insurances will for an appropriate candidate. And I think if you get involved with a comprehensive type of program where they're following all the rules and regulations, it's in their best interest to see their patients get healthier with these types of operations.
I'm sure you're somewhat biased, but I'd love to know your opinion on why someone should go to Adventist Health Castle for the bariatric procedures.
I think we bring a level of experience. We've been doing this over 13 years now, over 2,000 cases. I've probably done more than anyone in the state. So there's that level of experience. I think there's a level of transparency that we bring. We meet the best benchmarks for safety and performance, and that's proven through MBSA AQIP certification, which is a governing board for the surgical society that governs me. And I think also that we probably have a very transparent process in terms of getting people through the system to that operative date and a commitment to long-term follow-up.
Let me also ask you this. Somebody going through a procedure, getting ready to do a procedure, do you also help them with their diet and changing their diet, maybe the amount they eat?
Yeah, again, the operation, that's a very tricky type of procedure, but if it's done well and safely, that's kind of one day of work. But the whole package involves a comprehensive component, which means lifestyle intervention with diet, psychological intervention, exercise. So we have a team that's dedicated to that type of setup, and that's the best possible recipe for long-term success.
And of course, success and the different results vary according to the person you're with, I'm sure.
I think so. There are averages that you would expect for someone to lose with a weight loss, but it is variable. It's dependent on the individual.
Where can somebody get a little more information about all the things you spoke about, the different procedures, or Adventist Health Castle and their bariatric department?
Give us a call. We're available every day. There's also our website. And I think we now have a YouTube station where you can kind of see us talk about the different procedures, the good and the bad, the associated risks and benefits, and see if this might be something right for you.
Stephen, thank you so much for taking time out of your busy schedule to join us and let all our viewers know about it.
Hey, thank you so much.
All right, much more on Living It Right when we continue.